Have you ever noticed a tiny blank space in your vision, a spot where things just seem to disappear for a moment? It can be a little unsettling when your eyes suddenly don't capture everything they usually do. New blind spots in your vision, also known as scotomas, mean that an area of your retina, optic nerve, or brain is not processing visual information correctly. These visual interruptions are always a signal that you should have your eyes checked by an eye care professional as soon as possible. The why behind a new blind spot is quite important because it points to various underlying issues. Your visual system is incredibly complex, converting light into signals that your brain interprets as images. A blind spot occurs when any part of this pathway is disrupted. For example, it could be a problem with the retina, which is the light-sensitive tissue at the back of your. Conditions like macular degeneration or diabetic retinopathy can cause damage to retinal cells, leading to these blank areas. It might also involve the optic nerve, which transmits visual data from your eye to your brain. Glaucoma, for instance, can progressively damage the optic nerve, creating subtle blind spots that may widen over time. Even issues within the brain itself, such as a stroke or a tumor, can manifest as blind spots because the brain is where visual signals are ultimately processed. If you notice a new blind spot, your first and most crucial step is to contact your eye doctor immediately for an urgent evaluation. Explain your symptoms clearly and be prepared to describe when you first notice the blind spot, if it is constant or intermittent, and if it affects one eye or both. During your visit, the eye care professional will perform a comprehensive eye examination, including tests like visual field testing, to map the extent of the blind spot and optical coherence tomography to examine your retina and optic nerve in detail. Understanding that not all blind spots are immediately obvious to you is an important insight. Your brain is incredibly skilled at filling in missing information, especially with both eyes open, which is why regular comprehensive eye exams are so vital. Many serious eye conditions can progress silently, causing significant blind spots before you even notice them in your everyday vision. For instance, early glaucoma often causes peripheral blind spots that go unnoticed until significant damage has occurred. Taking action quickly when you detect a new blind spot allows for early diagnosis and treatment, which is often key to preserving your vision and preventing further loss. Addressing the root cause, whether it is an eye condition or a neurological issue, ensures you receive the care needed to maintain your overall eye health and enjoy clear sight for years to come.